Hello everyone, my presentation today will be about the opioid epidemic. The opioid epidemic began in the late 1990s when a pharmaceutical company reassured medical professionals that the opioid pain relievers were not going to be addictive. So because of that belief, providers began to prescribe these pain relievers at large amounts. Fast forwarding to 2015, over 33,000 Americans died from an opioid drug overdose. And now every day, over 115 people in the United States die due to overdoses. So you can really see how much this opioid epidemic has gotten out of hand. This epidemic caught the federal government's attention, and President Donald Trump announced on October 26, 2017, that opioid crisis was a national public health emergency under federal law. In doing so, he directed all his executive agencies to fight the crisis. In terms of healthcare, President Trump stated that the medical professionals, as well as the first responders, will be given more access to tools to treat opioid overdoses to save lives. Then on March 29, 2017, he introduces Crisis Next Door, which is a website that people can share their story to help others find a way to recovery. This way of handling the issue is great because it causes everyone in the nation to become more aware of how significant the opioid epidemic is. However, for the government to provide medical equipment, the amount of which it will cost is tremendous. Healthcare is already one of the highest contributing factors in the national debt. The beginning of this year, Nevada's legislature introduced Assembly Bill 474, which controls substance prescribing. In doing so, they added more steps and rules in the process of prescribing medications. This bill benefits Nevada by making providers think twice about prescribing medication, and it also decreases the amount of substances given to patients, so there is less risk for addiction. In addition, medical records will be maintained to a high level and patient-provider relationships will strengthen. On the other hand, this bill has instilled fear into physicians by giving them more chances to lose their prescribing licenses. And if there is fear, physicians will leave the state. Nevada is already in a physician shortage, and we rank among the worst healthcare in the nation. Also, if there is a decrease in physicians, Nevada's patients will be left with various issues to access healthcare. Overall, this bill causes many downfalls to our state. AmeriCorps Vista is a volunteer nonprofit program that targets low-income families and educates young adults and children about substance abuse and prevention. As of September 2017, they have been active in 4 states and making efforts to stop this epidemic. They also focus on economic opportunity, education, and veterans. This program does nothing but good. This gives people an outlet to find help when they cannot do it for themselves, and by educating young adults and children, they greatly affect the future. I currently volunteer at the radiology department of the VA Southern Nevada healthcare system, and I think the opioid epidemic will affect them by giving more examinations. They will probably use their modalities such as CT and MRI to get better diagnosis. In the future, when I become a healthcare administrator, I think it will affect the organization I work with to expand healthcare access and implement new policies or create investments to further support the issue.